Hoffman, and welcome back to Healthy Living. It's been in the news in Guam and all around the world. We're talking about the Zika virus. I'm here with Dr. Gray Hirata, who's based out of Honolulu, Hawaii. He specializes in both genetics and maternal fetal medicine. So, Dr. Hirata, can you tell us what is the Zika virus and what are its effects on pregnant mothers?
Well, the Zika virus, prior to 2015, was not well known. It was discovered in 1947, but it was not thought to be a major cause of health issues. Recently in Brazil, they've been reporting many cases of microcephaly. They attribute to the Zika virus infection in pregnancy.
Okay, so is this a definitive link between the microcephaly, or how strong is the evidence?
Well, the evidence is still coming in, but the evidence is very compelling. They find it in placenta tissue, they find it in the fetal tissue and the amniotic sacs and amniotic fluid. So I think that the evidence will be compelling and probably confirmatory that the Zika virus seems to be the pathogenesis of the fetal anomalies we see.
For people who don't know, what exactly is microcephaly?
A microcephaly is a small-sized head. That's basically the definition. However, you could get microcephaly from various reasons. Infections in utero, besides the Zika virus, have been associated with microcephaly. You see microcephaly in certain genetic conditions as well.
Okay, well, the Zika virus has been spreading throughout the Pacific. Recently, there have been cases in Tonga, American Samoa, most recently in the Marshall Islands in Madro. And this woman didn't have any travel history outside of the country. So can you tell us, what does that mean?
Well, it means that she probably acquired the infection in the Marshall Islands. The Marshall Islands has been designated by the CDC as an area of active infection, and you should consider it those pregnant women in the Marshall Islands at risk for congenital Zika virus infections.
Okay, will ultrasounds detect Zika-related birth defects?
Yes, it can. However, it's going to be late in the pregnancy. And the things that we look for, besides the small heads, we sometimes see destruction of the brain and other intracranial findings. You can see small babies, low amniotic fluid. It's been associated in Brazil with fetal demise and miscarriages as well.
Okay, so what are the recommendations then? Say you're a woman who's a pregnant mother who's traveled to an area with Zika, or you live in a Zika area. What are the recommendations for testing?
Well, I think if you have traveled or live in an area that has active Zika infections, there's always an option of testing even an asymptomatic patient. That includes very sophisticated tests that have to be done at the CDC or in local labs that are equipped to do it. There's no commercially available Zika virus infection testing available. The patients that have symptoms, and that would be rashes or low-grade temperatures or conjunctivitis, which is an inflammation of the eye, they can be tested if they've either live in an affected area or if they have traveled to an affected area. It should also include if the partner has traveled to an infected area, because there's signs that Zika virus can be transmitted sexually as well.
Okay, I know that's also an issue. You mentioned that it's not Zika testing isn't commercially available. So here in Guam, there's no testing here, so results would have to be sent to a lab in Hawaii.
Yeah.
Can you request your doctors if you're concerned?
Yes. If you fit the criteria, meaning that if you have symptoms, have traveled in a Zika infected area, or live in a Zika infected area, you can request testing, and it's most likely going to be sent to the CDC, which, as you can understand, is being overwhelmed by many tests across the nation.
Okay, so what is the scariest thing about Zika infection?
Well, I think the scariest thing is we don't know. We don't know how it works. We don't know what percentage of patients that get exposed get infected. We don't know if you become infected, what's the likelihood of the baby becoming infected? We don't know what the long-term outcome of the babies that may be infected, but otherwise are not showing any signs of microcephaly at the time of birth. So there's a lot of unknowns right now. That's the scariest part.
I think another scary thing is that a lot of people are asymptomatic. They don't actually show signs of infection. And I also wanted to ask, what if the pregnant mother tests negative? Is it possible that there could still be the signs of Zika in the amniotic fluid?
Yeah, it kind of depends during the stage of the infection when the mother was tested. But the mother could be testing negative, but the baby is infected.
Okay, so lastly, this has been something that's been discussed here in Guam for several months now. But is Zika something that we should really be concerned about here in Guam?
I would say absolutely. Any tropical state of Hawaii and Guam, are going to be susceptible to it because the primary mode of transmission is by mosquitoes, and we have mosquitoes here year-round. You're also very close to active infection area, Marshall Islands, Yap, and people in the Philippines, and people travel back and forth all the time. So I think it's inevitable that your Guam as well as Hawaii will be an area of active infection. It's just a matter of when. I think in the continental United States, it's probably going to be in the summertime when the mosquitoes are more active. But in Florida, California, Texas, they're already reporting cases of people that have traveled in who acquired the infection outside but are now currently living in that state and have had babies that were affected. And in Puerto Rico, it's considered an area of active infection as well. So I think it's spreading, and I think we're just seeing the tip of the iceberg right now.
Yeah, there's still so much more to be known. There's no cure for this disease right now, but definitely physicians and scientists are continuing to research the virus. So thank you so much, Dr. Hirata.
Sure.
I really appreciate you
Sure.
coming on the show. All right, well, stay tuned. Healthy Living continues after the break.